Well, voting in the U.S. Senate on changes to President Donald Trump's $3.3 trillion spending bill has entered its second day. The bill is aimed at funding deportations and boosting defense and energy spending. It includes big cuts to health care and food programs, and it could result in millions of people losing health insurance. Republicans are divided on some provisions. One of them is the Medicaid program, which helps low-income Americans get coverage in a country with notoriously expensive medical insurance. All right, well, to talk about the potential implications of these Medicaid cuts, I'm joined now by Dr. Owais Durrani. He's an emergency medicine physician in Houston, Texas. Dr. Durrani, it's good to have you with us. You're the ER doctor that people see there in Houston when they go to the emergency room. Give us a good estimate. How many of your patients are on Medicaid?
Yeah, thanks for having me. A very large percentage of my patients are on Medicaid. In Texas, if Medicaid were to be cut in its current form, we would have an uninsured rate of 20%. And so what that means is, people come to the ER when they are having an emergency. If you lose insurance, you're going to come to the ER when you're having a worse emergency. So you're not going to be able to get primary care. You're not going to be able to stay on top of your chronic medical conditions. And you're going to show up to the ER in worse decompensated conditions. And we know from a lot of data, and then myself from personal experience, that those patients have worse outcomes, including death. And we know that if this bill passes in its current form, we will have an additional 55,000 deaths yearly. And that is just unconscionable. And it's hard to even say those words.
So the emergency rooms in the United States, they should be bracing for what, if I understand you correctly, is a tidal wave of more patients, correct?
Absolutely, yeah. So we are the front door of the healthcare system in the United States. And so when patients have nowhere to turn to, they show up there. We currently have overcrowding just as it is. We have a 13% uninsured rate across the United States. And so we should be trying to expand health insurance, not decrease it. The other thing that Medicaid pays for is nursing home care. And so a lot of times when we get patients in the hospitals, we'll stabilize them, treat their infection or whatever they're there for, and try to get them discharged back to a nursing home or a skilled nursing facility. Well, Medicaid pays for that. And so when you lose funding for that, 1 in 4 nursing homes are projected to close. And so we're not going to be able to get those patients discharged from the hospital. So not only are we going to have a rush coming into the hospital, the patients in the hospitals won't be able to leave, and it's just going to worsen the problem.
Well, help us understand this then. If people lose their Medicaid coverage and they come to the emergency room in an emergency, who absorbs the cost then if they can't pay the bill?
Yeah, so when you show up in an emergency, we're going to take care of you. And so they're going to be taken care of. Unfortunately, they're going to be in a worse off condition, probably going to have worse outcomes. But then what happens is the hospital has to get paid, right? And so they're going to negotiate higher rates with private insurance companies, those rates, and then they're going to pass that on to their insured population. And so even if you're not on Medicaid, your insurance bill is going to go up. Someone's going to pay for it, and it's going to be the American public. And so a lot of times it's framed as, hey, I'm not on Medicaid. It's not going to impact me. It's not going to affect me. It will affect every single person in the United States if these programs are cut.
And for our viewers, too, who may not be familiar with Medicaid and nursing homes, I mean, you're right. A lot of people do go to nursing homes in the United States. It's paid for by Medicaid, but that comes with a big provision, and that is they have to spend down all of the assets that they have until almost nothing. So if you're forcing people to spend themselves poor before you get Medicaid, what does this mean then if Medicaid's not even an option?
Yeah, it's unfortunately going to mean an increase in uninsured rate here in Texas. As I kind of mentioned, we're going to have a 20% uninsured rate, which is terrible. We already are amongst the worst when it comes to various health outcomes. Those will get worse. People will delay care. They'll show up to emergency departments sicker. And the other part that I'd like to point to is that rural hospitals will close. So for a lot of folks, rural hospitals are lifelines. And if those close, they may be 2, 3, 4 hours away from the closest hospital, which means if you're having a heart attack or a stroke, you're not going to get the care you need in time to prevent the worst outcomes of those diseases.
Yeah, that's a very good point to make. The country hospitals, they seem to be dying out as well. Dr. Durrani joining us from Houston, Texas. Dr. Durrani, we appreciate you taking the time to talk with us. We know you must be a busy man. Thank you.
Thanks for having me.
All right, I want to pull in now Jackson James. He works for the German Marshall Fund think tank. He's a political analyst, a familiar face to our viewers. Jack, good to see you again. Let me just ask for your thoughts on Elon Musk, again, chiming in against this big, beautiful bill. What do you make of that?
Well, he's got a reason to do that because this bill is going to cancel out green energy advantages for him and his company. So I think he's taking it out on that matter as well. But he's also had some problems with his dealings with Trump anyway. So in that respect, I think it's not surprising.
Let me ask you about the bill itself, or what Trump is trying to do. I mean, we're talking about $3.3 trillion. What do you think Trump is trying to do with a big spending bill wrapped in big tax cuts?
Well, I mean, there's two concepts here, Brett. I think it's power and prestige. Power in the sense that he has control of the Republicans in both chambers, and this would be a prestige issue if he was to lose this election, this vote. It would not do well for him going forward into the second part of his term. The power side of it is that he wants to have the ability to say that he has kept the tax cuts from being canceled, which would increase taxes for almost all of the areas of the country where people voted for him. And I think he's trying to also make his call that this is necessary for his major issue, which is immigration. And the issue is also going to be whether or not he can convince people that this is not going to be increasing the debt by $3.5 trillion, that I think is something that is very difficult to defend.
Well, I mean, we know all the government agencies say that we're going to have an increase in the debt because of this bill. And you would expect the Republicans to say we're not going to be a part of that, but that is not the case now. Is immigration reform, deportations, do they now trump saving money?
Well, I think so. I mean, basically, that's the major issue that he ran on in 2024, and lots of money, billions of dollars are going to go toward creating prisons and detention centers, and of course, the proverbial wall that he wants to build. So that's a major issue for him right now. But I think the other side of that is that if he doesn't get this bill passed, then the taxes go up, and that's going to be almost a primary factor in 2026 during the midterm elections. And it's not unusual for a president to lose votes in the House and in the Senate in the opposite party in the elections that are midterm. So he's worried about that as well. But there's one more thing, Brent, that's important to remember here. Trying to get this bill passed is not an executive order. It's a bill. It's law. And that's something that he's trying to get through so that he cannot be turned around by the next president after him, regardless of who that is. It's much more difficult to change laws than it is executive orders.
I want to ask you, I've got 30 seconds left, Jack. I mean, this bill, as you say, it's legislation. We're talking about huge deficit spending, enormous debts. Can the United States afford this type of debt?
No. But the problem is that there's no way for them to get around this other than by saying that if you keep the taxes down and people begin to have more money, then they will invest it in the country. It's an old saw about the fact that reducing taxes leads to a better economy. There's no evidence for that now. And we're talking about 30, possibly even 40 trillion that we're looking at the end of 2028.
Jackson James, as always, Jack, we appreciate your time and your insights. Thank you.
Appreciate it.
NDW reporter Stephen Beardsley is with me in the studio. We've seen a lot of executive action coming out of the Trump administration since he returned to the White House. Now this is his first big signature legislation. And it's a quite ambitious bill, isn't it?
It's quite ambitious. It's also, in true Trumpian fashion, quite chaotic. This is a bill that tries to jam essentially two big things together. One is a quite expensive extension of Trump's tax cuts from his first term. These are tax cuts that do affect a majority of households across the U.S., but they really favor those that are a bit more well-earning. And then on top of that, there's additional spending in the form of tax measures, but also hundreds of billions of dollars for border security and national defense. And it tries to do this on a very tight timeline. That is by Friday, July 4th. Optically, that's very important for Donald Trump. What we're seeing right now, when we look at the Senate, we look at the Congress, they're trying to basically reshape this a bit in their own kind of way to make it more palatable. That may include, for example, cutting certain social provisions, such as medical insurance for the poor, to tamp down on how much this costs. That may include taxing renewable energy, which is something new and came out of the blue just the other day. That's also made Elon Musk especially upset. So they're trying to reshape this, and that's where a lot of the drama is. All
right, so that's why it's such a nail-biter. This bill would mean historic spending for the U.S. Can they even afford that at this point in time?
The U.S. has always had a special kind of relationship with debt in that there's always been other nations willing to buy it, investors willing to buy it. And that is not going to change rapidly, but there are cracks in the edifice that we're starting to see. And so investors are going to start requiring more money to borrow, essentially, or to lend their money to the U.S. And that's where the concern is that when you see these kinds of measures, $3.3 trillion is what this will add to the U.S. debt over 10 years. That's the projection. That's significant.
Stephen Beardsley, thanks so much.